all of you to our event, Surveillance and Security After the Lockdown, Lessons from 9/11. I'm joined by my distinguished colleagues, David Hoffman from the Stanford School of Public Policy, Jolynn Dellinger and Shane Stansbury from the Duke Law School. And we're thrilled to have you all with us to discuss this very timely and important issue. Before we dive in, I just want to thank all the people who made the event possible. First, our institutional sponsors, the Stanford School of Public Policy at Duke, the Duke Law School. We're very excited to partner with the Duke Alumni Association. And on behalf of all of our panelists, I want to welcome and give our heartiest congratulations to our newest Duke alumni, the class of 2020. And I hope we have some of you on the line with us today. This is a program as part of the program on American Grand Strategy. And this will be our last Grand Strategy event. And we'll see you all back in September for more, as well as the Center on Law Ethics and National Security at the Law School. And thank you as well to the individuals who made this possible, been working on this event for weeks and have arranged the Zoom and everything. Beth O'Brien, Susan George, Samantha Fisk, and Jen Chambers from the Alumni Association. And before we begin, I just want to remind all of our participants that if you participate and you speak, we are recording this. So you've gotten your privacy notification and your implicit consent to be recorded. So thank you very much. Let me set the scene and kick it over to our first panelists. But all around the country now, we're beginning to move into a new phase of the response to the COVID-19 pandemic, where we're beginning to open up the economy and have more social interaction. And it's very clear, our public health authorities have made it very clear that contact tracing, the idea that you can trace from an individual who has the illness to people that person might have exposed to the illness, to notify them, quarantine them, get them treatment, and so on, get them tested and then treated if they're sick, is a very, very important way to contain the outbreak and once we get the infections down to a manageable level, to try to contain it and stop its spread. And countries around the world and here in the United States, states and localities are all considering how we might use new technology tools relating to location data and other uses of other data through technology to assist, to supplement, and make more effective traditional public health contact tracing methods. Technology might also be used, these same technologies might also be used to enforce social distancing norms or quarantine of infected people down the road. Technology might also be used, and some countries are piloting and implementing a type of electronic passport to show if you have antibodies, and therefore can maybe move throughout the economy more with more liberty than others. So when we talk about these technologies, they could be implemented in all these different contexts. So with that scene setter, that's what we're going to be talking about today. Let me pass it over to David Hoffman to start us off. Thank you, David.
Oh, thank you, David. And so as David was noting, there are a lot of different problems that people are trying to solve with technology. And a lot of them involve the collection of data and some form of something that we might call surveillance. And so what has been fascinating to watch is that while we in the United States now look to have our individual states pursue creating their own methods for solving different problems, there's also a number of countries that have already gone there and have already been exploring a number of different solutions. And so a lot of those solutions, as David had noted, involve the governments working with big companies, large technology suppliers to help create the individual solution. One thing that we see, though, is that it's not always clear exactly what problem those technology companies are creating their particular tool to solve. So let's take the Google and Apple app or the AI voluntary exposure notification setting that they have been creating for people to create apps on top of it. It's an API that would allow people to be notified when someone voluntarily enters that they've been tested positive. And then if the Bluetooth setting in the phones has noted that two people have been in proximity to each other, then someone else could be notified that they may have been exposed to COVID-19. So that's one particular problem, which would be voluntary exposure notification. But that's not what we would traditionally think of as contact tracing. Traditionally, we think of contact tracing in the model that it's been used in other public health emergencies, particularly for combating sexually transmitted diseases and Ebola. But we've got a very unique situation here. Unlike sexually transmitted diseases and Ebola, COVID-19 is transmitted much more easily with much less contact, and individuals can be asymptomatic and still be passing the disease. This creates a lot of problems in actually defining what solution that you want to use to combat which particular problem. So for example, you could say you want a technology solution just to inform people when they've been exposed, or you might want to say you want to use the tool to gather data for epidemiologists, or you might want to have the tool to enforce quarantines, or you might want to provide tools for employers and schools to do their own enforcement privately of social distancing requirements. So once again, we can look to what other countries have been doing in the world to help inform us on how the individual states should be first articulating their individual problem and the things that they need to do to create the tool, and then third, what the privacy and civil liberty implications of that particular implementation would be. So I want to describe 3 of those implementations really quickly and then hand off for the discussion of the privacy and civil liberties implications. The first that I'd like to point out to has been the UK implementation and the model that they're pursuing, which I think is really fascinating. They have been involved in a debate about whether they should take a centralized or a decentralized approach. So their problem that they were originally saying that they wanted to address was one where they wanted to be able to notify people if they had been exposed, but they also wanted to gather epidemiological data and hold the possibility of doing contact tracing. To do that with their particular solution, they couldn't use the Apple-Google API approach because that only provides for voluntary notification, and there's no centralized data repository to understand how many people are coming into contact with each other. All the storage is done on the individual endpoint device. So they moved to doing their own app with a centralized approach, but then there's been such a privacy and civil liberties backlash, they now are considering moving again towards a decentralized approach. So if you take the first goal, they are trying to figure out whether they're just going for exposure notification or whether they're trying to do something bigger than that. Another country that's very interesting, I think, to look at is Singapore and what they did with their Trace Together application. They were very clear on what problem they were trying to solve. They were doing contact tracing in the way that traditionally contact tracing has been done. But when they looked at what technology they were going to use, and they looked at using Bluetooth, similar to what Google and Apple have been saying, they realized that alone was not going to give them the information that they need to be able to effectively do contact tracing. So they have then supplemented it with other technologies, particularly they do the normal kinds of in-person interviews of people once they've tested positive to find out where they've been the last 14 days. But they are now using technology to do data analytics on those interviews to actually give more information to them about what other contacts there might be. They also are looking at CCTV camera feeds and are looking at transportation data from trains and buses to supplement it. The third approach would be one that Korea has done. So Korea has done something very similar to the contact tracing approach that Singapore does, but they actually have another app to solve another problem, and that's quarantine enforcement. And what Korea decided is, look, in addition to doing contact tracing, they would really like to understand, once somebody has been diagnosed as positive, to actually be able to enforce the quarantine. And they do that by creating a geofence with not only just using Bluetooth data then, but using GPS data. All of these different approaches create different privacy and cybersecurity implications and civil liberties implications for that approach. And to describe a little bit more the different trade-offs that are created, I want to pass the baton over to Jolynn.
There we go. So we do have to focus on coming into the United States. What are the characteristics of our environment that are going to make us receptive to various aspects of the response to COVID? And so the two issues that I want to focus on, one teed up so well by David, is the need for a very deliberate decision-making process for our COVID response in the United States that balances the effectiveness of tech solutions on the one hand with the privacy concerns that are raised by the use of those tech solutions on the other. And the second is the fact that trust really matters when it comes to technology and the use of our personal data. And this is going to be trust in the government, trust in corporations, and trust in legal protections. So as we're coming into the United States, we can see that 3 or 4 states have already started exploring and implementing different digital contact tracing applications. North Dakota, South Dakota are using Care19. Utah is using Healthy Together, which involves GPS, location data, and Bluetooth. Colorado is exploring some apps. And then other states are allocating large amounts of money to building up their manual contact tracing, which of course also has privacy implications, but is a tried and tested approach to infectious disease in the United States. Also, we have employers and universities trying to decide how to reopen, just as states are trying to decide whether to reopen their economies. So as we're going through all this, a reasonable goal is to make the most effective use of technology while minimizing the incursion on privacy and the potential for misuse and abuse of data to the extent we can. So in looking for a deliberate approach to this, I'm hoping that these entities that are looking at these questions will look at 5 questions. What is the problem we are trying to solve? Just as David said, this is sometimes glossed over and people are like, here's a tech solution, but they haven't truly defined that problem that they're trying to solve. So what's the problem we're trying to solve? What is the proposed solution? Is that solution likely to be effective? Would it intrude on our privacy and on our civil liberties? And if so, are there sufficient safeguards in place? So I think it's helpful to just look through these various questions in the context of digital contact tracing. So here, I think what we're looking at in particular is trying to return to work, trying to open our economy, trying to keep going, even though COVID is still a threat and there's not a vaccine. How can we minimize the spread? The proposed solution that we're talking here today is digital contact tracing apps. There are, of course, as David mentioned, Schanzer mentioned early on, many other types of things that you can apply this analysis to, including the immunity passports, house arrest technologies, quarantine monitoring, thermal imaging, and drones. But for this purpose, we're going to look at voluntary digital contact tracing apps. Are they likely to be effective? That's the important question. And I think the answer is possibly, but only in certain circumstances. It's not a silver bullet. So what are the circumstances that we need to make sure that it's effective? I think experts are agreeing that it's only going to work in a context of a more holistic, comprehensive response with many aspects. Here in the United States, we need adoption. Any kind of app that we're going to use, we need adoption, they're saying, by at least 60% of the population to effectively reduce the spread. We need testing on demand. We need free testing that's widely available. We need a substantial expansion of our traditional manual contact tracing systems. I think I read we have about 2,500 contact tracing professionals in the country now. Johns Hopkins is suggesting we need 100,000 to address the COVID spread. Continued social distancing, substantial healthcare system responses, and also commitments to quarantine and self-isolation when an app notifies you of exposure. And then one of those questions is, will people in the United States actually voluntarily use an app like this? And this is where the privacy issues come in part. Right now, the studies are showing that 3 out of 5 Americans are unable or unwilling to download a contact tracing app. And there are various problems there. Some of those have to do with lack of access to the device because of cost. Some have to do with inability to use such a device. Maybe you're older and you don't know how to use that technology. And then there's unwillingness. And this goes to issues of trust and privacy. Lack of trust in government and corporations are cited in these studies. So would this intrude on our privacy and civil liberties? Yes, it would. I mean, contact tracing is a form of surveillance. Is it a good idea? It still could be a good idea, but we have to acknowledge that it is an invasion of privacy to a certain extent. We're talking about sharing healthcare information, that's sensitive. We're talking about location information, which the Supreme Court just recognized the sensitivity and importance of this information in Carpenter and other cases. And then we're talking about the very serious danger that new surveillance permitted by new tech becomes the new normal. And so those are all privacy risks. But then we go to the last question, which are there sufficient safeguards? And that's where other privacy principles can come in to say, from a privacy perspective, can we make this work? And I think you have two things to look at here, the design and also policy issues. So the Apple and Google partnership that we're talking about really seems to be trying to focus on building privacy into the design of the API. Bluetooth technology instead of using GPS or CSLI, decentralized structure instead of centralized, functional anonymity of individuals, and of course, voluntary adoption. These are all things that can be part of design. And then in addition, you have important policy considerations. Aside from something being voluntary and you get to choose whether to use it, there are also things that are traditional in our understanding of privacy law, which are a limitation on the collection of data to what is strictly necessary to accomplish the purpose you're trying to accomplish, and strict limitations on alternative uses of data. So if these apps collect data for use of COVID, you cannot use it for other reasons. You can't monetize that data. So strict limitations on alternative uses, no access by law enforcement, and in fact, some places are considering potential criminal consequences for misuse, abuse, or monetization of COVID data. Limited retention of data. Don't keep it for very long and delete it from servers if it's centralized. Limited groups of people with access to the data. And of course, other people are considering sunset provisions so that these types of technologies go away. This type of surveillance goes away at the end of the crisis. But none of these things that I'm mentioning that are policy considerations are guarantees. It's more like a wish list. It's a best practices list at this point. And that brings us back to the idea of trust. So past behavior of companies like Facebook and Google, whose very business model is fundamentally premised on the collection and use of data, don't necessarily inspire confidence in people who are worried about their personal information. Past conduct by the government as well, which will be discussed later on in the panel, combined with a lack of comprehensive protection for privacy at the federal level, all make people a little worried. And all of those things have eroded the trust that we have in technology and the use of personal data. So I think when you think of all of these things together in this very deliberate decision-making process we need to go through, it really demonstrates quite starkly how much it matters that we as a country choose a legislative manner of dealing with privacy and data use and emerging technology that will, going forward, enable people to have the trust that they need to voluntarily use these things that can help us battle a national health crisis. So that's what we're looking for from the kind of state level and local level. Shane?
Okay, I seem to be unmuted now. Thanks, Jolynn. So a couple of themes there that I just wanted to pick up on that I thought were really important. I thought Jolynn's framing was really good. The issue of trust is obviously an important one, and I want to get to that in a minute. But there was also a theme about balancing. And I'm going to talk a little bit about some lessons from the 9/11 era. And the reason I think that those lessons are relevant in part is because it teaches us a little bit about that balancing process. And I'll just say, I think what's probably explicit from the comments so far is that if we're going to have effective digital contact tracing, and I don't know that we can, but if we are, it's going to require some really, really hard choices. And if we're going to make those choices, we need to be realistic and we need to be honest. We're not going to have perfect privacy, and we're not going to have a perfectly effective app. There's going to have to be, I think, some give and take. So that's why I think it's important to think about our experience from the 9/11 era, because it's not a perfect parallel, but it is a context or a framework through which we can look at our current crisis. Because, for the last 2 decades, and I know many on this call probably have been involved in some of the debates over the last couple of decades, but we've been thinking seriously about surveillance and privacy for a long time. And we've been seeing this sort of pendulum swing back and forth, trying to get the right answers. And there's not a perfect parallel, but I think there are some really important lessons that I think are relevant. So let me just go through a couple of them, because I want to get through my comments quickly so we can get to Q&A. But when I started first talking with some of the folks, my fellow panelists, about this, I was coming at it from the national security perspective, and a couple of things struck me as similar to what we were facing after 9/11. The first was the fact that we were facing what you might call a crisis of information. We needed, after 9/11, think about it, we needed information fast, and we needed it at scale because we were afraid there was going to be another attack. And the second parallel is that the information that we need is not in the government's hands. It's in the control of private companies. And there are ways of getting that information. It could be voluntarily provided, or it could be compelled. And that's sort of an obvious point, but it drives the whole discussion about how we solve the problem that we're facing, because we have these dual constraints. And after 9/11, we spent a lot of time trying to figure out how we work within those constraints. We had to revise our surveillance laws to deal with that reality, because a lot of the information that we wanted at scale was in the hands of companies. And we didn't have the tools, the legal tools available to us to do that. And so I think if we think about our current crisis, if private companies are in the possession of the data that's going to help our public health authorities, if that information is going to help us get out of our crisis, what kind of information are we willing to let those authorities have to get us out of the crisis? And if we're going to rely purely on the volunteering of information, is that going to be enough? Are we willing to live with that? If we're willing to provide some information, what are the restrictions we're going to place on that? And frankly, what are the restrictions we're going to place on the use of the information by third private parties as well. But apart from those two themes, I wanted to get into some specific lessons. And obviously, as I mentioned, the parallels are not perfect. I think one important difference, obviously, is that we're not talking about a large federal government surveillance program. The relevant stakeholders are not the intelligence agencies. They're a smattering of state and local health authorities. And that's in some ways easier because you're not dealing with sources and methods and things like that, but you are dealing with multiple independent bodies, which makes it more complicated in terms of getting a level of consistency and making sure there's the right level of expertise and oversight. But differences aside, I want to go through 4 lessons, at least, that I think are relevant for the 9/11 era, because as Jolynn mentioned, I think these apps are coming out, even if it's in a sort of hodgepodge manner. I think that we're going to see them roll out. And even if the lessons from the 9/11 era apply mainly to the federal government and a sort of federal surveillance, I think they're just as applicable to gaining the level of trust that Jolynn was talking about at the state and local level as well. The first is we need to be realistic about the information that's actually going to solve the problem and what it's going to cost to get it. I couldn't agree with Jolynn more than her on her point that the most important issue is efficacy. Is the data going to help us solve the problem? After 9/11, there was a common refrain that we needed the whole haystack to find the needle that was going to save us from a terrorist threat. And that was completely understandable and still is understandable to some degree. But we also found that it wasn't always, more information was not always helpful. And more information obviously comes with costs. It comes with costs to potential violations of civil liberties and privacy. It comes with costs in terms of preventing abuse or overreach. And it also comes, and I think this is an important one, with logistical costs. Sifting through a lot of information takes resources. And if it's hard or it takes time for the relevant authorities to get to the information that's going to be helpful, then the app is not going to be all that, is not going to get us very far. And so we need to be realistic about what it takes, what information we need, and about those costs. And so when we talk about something that is privacy forward, like the apps that are being promoted by Apple and Google, I think that's a valiant effort on their part. But if it doesn't get health authorities the information they need to follow up with folks who may have been affected, or if it doesn't give them the information they need to track infection patterns, then it may create more problems than it solves. And so I think that public health authorities, there needs to be a transparent process by which public health authorities are telling us what is the information that is going to be required to have an effect. And then we can build the privacy protections around that. The second lesson I think that is helpful from 9/11 is the issue of the lesson of transparency. Many on this call are familiar with the blowups that occurred in 2005, 2013, when it was disclosed that the executive branch was involved in the kinds of surveillance that the public had not bought into. And we don't need to get into the details of that here, but the overall lesson was that ultimately we could achieve public buy-in for certain programs if we had a robust debate around those programs. And so we have ended up with surveillance tools that have gotten us pretty far because the public was willing to buy into those after a debate. And so we now have laws on the books that we didn't have in 2001, but that created a certain level of legitimacy with the public. And so that's why I think it's going to require some leadership that I haven't seen so far from Congress and the state legislatures to give the public the opportunity to have that buy-in, set a floor of protection at the congressional level to give the public some confidence that their data is going to be protected. The states can build on that. I think without that level of transparency, you're going to have a hard time making these things effective and for people to adopt them. Third point is that we've seen that if you are going to enact legislation, sunset provisions are helpful. We've seen those work on a number of occasions in the national security context, and they've been pretty routine, and they just seem like they fit like a glove in this context, given the kind of crisis we're facing. And the last point is that oversight works. Many on this call are familiar with the Privacy and Civil Liberties Oversight Board, and they played an active and productive role in assessing surveillance tools over the last several years, and have added some legitimacy and helped us reform some of the programs. I think the same kind of thing can be done in this context, both at the federal and state level. And there's also a role for inspectors general as well. But I think if the public sees that kind of oversight, then you might have at least a fighting chance of having the kind of trust that Jolynn has been talking about and having some public buy-in. I will leave it at that in the interest of time and turn it over to David Schanzer.
Okay, thank you, Shane. I'm going to say a few words, but I want our audience to get ready for the question period. We're having some problems with the chat function. So if you'd like to submit a question in writing, or you'd like us to recognize you and we'll put you on to ask it directly, you'll need to text skg17@duke.edu. I'll repeat that. skg17@duke.edu. We welcome questions from our students, our alumni, and our other guests. skg17@duke.edu. I'm sorry, that's an email, not a text. Let me just try to synthesize a little bit of the discussion. I'm very much of two minds on this issue. It seems to me that we need to get this contact tracing right in order to move back to normalcy. And I'm also convinced that, especially after engaging with some of my colleagues for the last 3 or 4 weeks on this, that something that is fully voluntary, anonymous, and does not involve some form of government access is not really going to be very successful. So I'm sympathetic to Shane's ideas about how, if we can't have those protections, how to build in other kinds of privacy protections into these apps. So on the one hand, I'm very inclined towards these efficacy discussions. On the other hand, I view these tools with a lot of suspicion and caution. And that stems a lot from my experience living in China for 6 months after I had taught and studied this topic for a number of years. And I think we need to understand that some of the technologies and the tools and the platforms that we're talking about that take multiple forms of data, facial recognition, location data, financial transaction data, and amalgamates them and puts them in the hands of law enforcement and the state security apparatus are the very tools that were used in China and have been developed in China to repress the Uyghur population in Western China, and it's led to the detention of over 1 million people into these camps. Of course, it's not the technology's fault, and versions of these tools have even been adapted in different democracies. And if you think about it, where you go, who you talk to, those are the very backbone of social interaction and political life. And that's the data that is being collected, analyzed, and maybe used for some sort of enforcement process. So let's be careful. If we're developing a massive universal tracking system, we have to be careful that it's not a step towards authoritarianism. So some of the solutions that I would put towards the problems that Jolynn, while trying to address the efficacy that Shane mentioned. So I'm very much in favor of a very decentralized system. I think we want to, by law and practice, keep the federal government and federal law enforcement as far away from this data collection and analysis process as possible. And I would really, especially at the outset, try to push responsibility as low down as possible to smaller and local entities, employers, universities and schools, and local public health departments. One of the lessons I draw from 9/11, pulling on Shane's ideas, is the problems with the TSA selectee and no-fly list. What we have is a surveillance and tracking system that is run by an impenetrable, unresponsive bureaucracy, a database that is often riddled with mistakes. There's absolutely no way to correct errors in the data, and it's totally non-transparent. And therefore, it hasn't been well accepted by the people who have been affected by it the most. And indeed, it has been challenged in court, and 15 years after its implementation, at least at the early stages of litigation, found to be unconstitutional. Maybe not in design, but in the way it's been implemented. And if we look at that app, which is, or that process, which has been applied to really only a tiny sliver of the population, I'm estimating that it's 4 orders of magnitude greater for contact tracing if we think it's going to possibly affect every American citizen. You can imagine the social resistance and potential implementation problems that something like this would cause. So that's a few of my ideas before we turn to our questions. So again, please email skg17 if you have a question, and let me see who we are going first. I think we're going to turn to Professor Dunlap from the law school.
Hi, how are you doing? I really appreciate this panel. It's given everybody a lot to think about, and you're ringing out issues that I haven't heard on this topic before. As challenging as the tech issues are, what I'm also concerned about is the human piece of it. It seems to me, I think I've read that there needs to be hundreds of thousands of these contact tracing technicians to follow up on the information, make the contact with the people. I can't imagine how that number of people could be acquired and vetted in the near term to be able to do this in, technically the right way, but also in a way that preserves everybody's privacy. It seems to me that that's virtually an impossible task to do that in the near term, but I don't know what I don't know. Thoughts?
I don't know who wants to take a whack at that one. I mean, none of us are public health experts who would be thinking about how to train this workforce. Personally, I've seen that the Bloomberg School has a online course already up. I've read about the state of North Carolina going through a hiring process, and obviously they'll need to be hired and trained. But Charlie, I think you raise a great point, is that whoever is creating the contact tracing system is going to have to train people not only in, how do you do the process, but how do you use the data in an appropriate way. And really, any sort of privacy regime, to my mind, needs to build in, personnel training on data use, data storage, what is permissible and what is not, and anonymity. And those rules, of course, have to be established before you start training the workforce. So you raised some good points. Maybe some of the other panelists want to comment on that as well. If not, those who want to tech or write a question into skg17@duke.edu should do so. And okay, I have another one. This is Katie Chen has asked, what dangers do we see with allowing platforms surveilled by other countries have such widespread use with the American population? For example, apps like TikTok. So what dangers do we see with allowing platforms, so I would think platforms like TikTok that have been surveilled by other countries, is that a problem to have that used inside the US?
David, maybe I can comment real quick on that. I think this is a big issue that even outside of the COVID situation, which really gets to how do we develop trust in the hardware, software, and services that we're using, particularly if we believe that there's an opportunity for the data that's being collected to be transmitted back to another country and potentially analyzed and used in ways that could disadvantage the United States. We actually have a fairly robust research program on that particular topic. I don't think that there right now are good solutions for that, and we need to develop better criteria for how to analyze those problems and what kind of controls we'd want to put on technology that's either developed outside the United States or is developed by a country that's or a company that's located out the United States. The solution to say that we're only going to trust technology that's fully developed here in the United States, I don't think is something that's going to be workable based on how we've developed the digital infrastructure. This is going to be one of the bigger issues of the next decade, in my opinion.
Thank you, David. Jimmy Toscano, I think we're going to unmute you so you can ask your question.
Sure thing. Thank you very much. And thank you to all of the panelists for talking to us today. It's been really informative. I was wondering if you all think that the changes that we have made and will continue to make in response to coronavirus might have similar staying power or like a shelf life or endurance as the changes we made in the post 9/11 world. And I also, in a similar vein, want to know if you guys think that coronavirus might occupy a similar place in our national memory or consciousness as 9/11 had, and if not, what makes it different in the way that we'll remember it as a nation and a world.
Well, I would just comment, and I'm sure my colleagues have views, but having lived through the 9/11 and the 20 years since then, and having lived through the beginning of this, I do think this is a quintessential moment really in world history, not just in American history, and it's going to shape a lot of the future. Even when we get a vaccine, I think the effects of what's happened already and what is likely to happen, especially as this disease moves to the developing world, is really going to make some fundamental shifts that we'll always be talking about, the COVID era or when COVID happened. And in terms of the things that we put in place, I think while there are some exceptions, and I'm sure Shane, might bring some of them up, I think we find with security measures that once they're put up, they're hard to take down. Because from a political perspective, if you weaken something, you say, well, we're going to just turn off the great tracking tool that we had. And then there's a new outbreak and a new problem. Someone will always say, oh, why did you do that? Whereas you can never be blamed if you're a leader for, well, yeah, I kept everything we had in place and something went wrong. Well, that's just because we needed a new tool or something new came along. It's not because I pulled back and you don't have that same threat. So Congress seems to be in the process of maybe deauthorizing some of the intelligence tools that we had during 9/11. But for the most part, I think, Jimmy, you're right, that once things get put in place, they're hard to take down. Others?
Yeah, I would just add that I think what is interesting about this crisis in comparison to 9/11 is we think in the back of our heads that there may be an expiration date of some sort, but we don't know when that is. And there may be markers for that. Maybe it's when we get a vaccine. Maybe it's when infection levels are either high enough or low enough to where we think we can move on. I think that's a little bit distinguishable than the mindset we found ourselves at after 9/11, where there was a threat that we thought might go on potentially forever. And we needed to institute some changes that would allow us to have the wherewithal to face that threat indefinitely. So I don't know whether this has an expiration date. It might not. There may be points along the way when we feel like we can, that we're ready to move on. I think the hangover effect is probably going to be determined by probably a lot by that vaccine date, or the point where we get enough antibody tests where we feel like we're it's safe enough to sort of move closer to normal. But I think that there is an opportunity here to develop some tools that that are short-lived. I wouldn't be so quick to conclude that Congress is going to. I don't think they're going to be in the business of sort of amping up our surveillance capabilities and using them for other purposes. I think the bigger issue is because of the decentralized nature of the problem in our healthcare system, there are going to be a lot of states and localities that are doing things that most of us are not aware of, and where there's not a lot of accountability. So I think that's probably a bigger problem.
All right, we're going to unmute David Medina for the next question.
Hi there. Nice. Great.
I'm sorry, David Medina.
Medina, thanks. Great discussion from David, Jolynn, Shane. Nice to see all of you. Having been at the Privacy and Civil Liberties Oversight Board, a lot of the things you've been discussing are quite familiar. Minimization, efficacy, transparency. We at the board looked at programs after the fact, and we're able to apply those considerations after the fact. We're now operating in real time. I guess my question to the panel is, sort of a process question is, how do we deal as a matter of procedure and structure to address some of the issues that you're raising with things that are moving real time in terms of developing new apps or government information collection? And are there any lessons we've learned from that sort of going forward about how to address these kinds of concerns in the future when it's both private sector, in some cases public or private-public partnerships that are developing these information collection and use tools? Thanks.
I would have a brief answer to that, which is that I think actually having this debate and these kind of conversations and getting this framework for consideration out to people who have to be making these decisions. So I think a lot of the folks who are making these decisions are in the healthcare field, they're in government. Privacy may not be the first thing on their mind when they're trying to deal with something in a different context. So encouraging that kind of 5-part analysis and thinking through each factor before you make decisions, and to really think about the fit and not just throw technology at the problem, not just collect data because we can and maybe we'll figure out a way to use it down the road, but very deliberately collect what we need and build our apps. And I think Apple and Google are trying to lead this in the right direction by promoting these privacy ideas and limiting what apps can build on the API, but to encourage these thought processes as we adopt our response, if we possibly can, would be great. And on every level, not just public health authorities and state governments, but every employer. every university, when it's deciding, are we going to reopen in the fall, think through that analytical framework. What are the consequences? What is the problem we're trying to solve? Do we have a good fit?
If I could build on some things that Shane and David and I have been thinking about, we recommended in an article today, available to you on the Hill, that we start putting boards like the Privacy and Civil Liberty Board in place before the apps are being implemented, so they can be doing oversight and recommendations and reporting to the public in real time to avoid the problem that you faced, which was a retrospective once the programs are already been operating for many years in some examples. We even had a discussion about, that it would be useful, whatever our university is going to be doing to try to open up in the fall, that we have kind of a oversight and a communications that can talk to the students and faculty who are going to be subject to whatever kinds of data collection that might be anticipated, and communicate with people about that, and have that kind of transparency, and not only for the privacy and civil liberties, but also to make them more effective, because the more people, if we can make them transparent, those are the things that try to help build public trust as well. Maybe my colleagues want to add on that.
David, I just want to add two quick things. First, David Medine, I just want everybody to recognize that the amazing work that you did as the founding chair of the P Club. And I think if anybody is interested in how you can actually do surveillance and still have privacy, I'd read the report that David and his colleagues wrote reviewing the 702 program under the Foreign Intelligence Surveillance Act. And I would go further to say, I think there's amazing work that the P Club has done showing that you can have privacy whilst doing surveillance, particularly when you're talking about the collaborations with having somebody who is responsible. And so the collaboration that David had with Becky Richards, who was became the chief privacy officer and chief privacy and civil liberties officer of the NSA, showed that you can actually put people in charge and have them work with organizations to impact the strategy up front of how decisions are made, instead of just cleaning up problems later on.
All right, for our next question, we're going to turn to Terry. I'm sorry if I mispronounced his last name, Masherin. Terry Masherin.
Done perfectly. Thank you all. Many of you have spoken about the fact that our public health systems are decentralized, and Jolynn in particular, you spoke of several different approaches that different states are looking at taking for contact tracing. Do any of you see any prospect for a federal approach to this? It seems to me awfully both cumbersome and fraught with error for 50 states to be going in 50 different directions.
Well, the Center for American Progress has an excellent paper and guidance for states where they're recommending at the very least regional cooperation. And I can try to find a link to that to post when we post the recording for this, this event. It's got a lot of really helpful information, but I do think that your point is excellent. And hopefully with the interoperability that the Apple-Google partnership is working towards, at least that will be one thing that helps different elements of this work together. But having 50 apps in 50 states and having people do their own thing across the country could be problematic. But I don't know if I'm real confident in seeing federal guidance at the moment. Does anybody think we might see that?
Well, I would just say I'm not sure we're going to get federal guidance. I think we do need it, but I think as we've talked as a group, this calls out very clearly that we need comprehensive federal privacy legislation.
Absolutely.
There's got to be a set of baseline standards on privacy that can be applied to all situations like this.
Thank you. Let's turn to a newly minted alumni, class of 2020, and most importantly, David Schanzer, alumni student, Alicia Perot.
Hi. So my question is relating to air travel and just like general, the way that travel and travel security changed after 9/11 was obviously very dramatic. And so I'm wondering what you guys think about the future of air travel and how it might get conflated with health testing. Do you think there will be sort of on-site health testing at airports, and what kind of privacy implications do you think might come out of that?
Well, we're definitely in a situation where, like after 9/11, there had to be some public confidence that people could fly safely. And in the first weeks after 9/11, we had National Guards, right outside of screening and security, heavily armed. Maybe that made people feel less safe, but so a lot of measures were put in place, and it turned out that the public ultimately did decide fairly quickly that flying, we were doing enough to make flying safe. Some experts and commentators feel like the whole TSA is more security theater than genuine security. But nonetheless, I think that was an important aspect of it. And so airlines are going to have to do the same thing now, which is to convince their customers that it is safe from a health perspective to fly. And so they're going to have to do lots of things that will convince the public of that. Again, it's going to matter more, especially in the short run, how the public responds to those things than whether they are necessary for the health risk that's involved. And so I think you're already seeing that with the announcements that they're making about no middle seat. But I think you're going to maybe see things like health screening at airports before you come in, and so on, to give the public the confidence that they can come back onto airplanes and still not get sick. Anyone else want to dive in on that one? Okay, Simon Sun, I think this is going to be our last question, and a class of 2020 from Duke Law. Congratulations, Simon. And
a Shane Stansbury alum.
Oh, well.
And a Dellinger alum, yep.
Oh my goodness, how did you make it through, Simon? That amount of rigor. Please. Can we unmute Simon?
Hi. So
nice and loud, Simon.
Oh, hi. So my question is about the Carpenter case, and specifically how, if the app is being developed, what is the implication or effect on the public's expectation of privacy based on the Carpenter case?
Well, that was a little hard to hear, so let me make sure the audience got that. I believe Simon was asking about, not a couple terms ago, a case called Carpenter, which basically held that for cell phone data, law enforcement, before they could get cell phone location data, actually needed to get a warrant. And so Simon was wondering if Carpenter provided that level of constitutional protection in a law enforcement context for location data, how might that affect a public health authority, let's say, that requires and collects health location data for a health purpose? And we'll let Simon send this to his two professors to answer.
You have thoughts, Shane?
Well, I was just going to say that obviously Carpenter looms in this context when we're talking about location data. I think it probably doesn't loom as large when we're talking about less precise location or proximity data like Bluetooth. And it certainly doesn't loom as large if you're talking about voluntary provision of that data or the collection of that data by private parties. So I think it's probably going to be less relevant in the short term, although I would keep an eye on it. But it does raise a separate question that was occurring to me in the context of the airport question, and David Hoffman alluded to this as well. I think setting aside the Fourth Amendment issues, I think one of the more interesting issues to look at is when these apps start getting used by private parties, so that it's not a question of government action, but how intrusive are private employers and others going to be able to get in terms of imposing restrictions on people returning to work and things like that. That may implicate state and local laws or specific statutes. It's less of a Fourth Amendment question. But I think that Carpenter is relevant, but I think there are probably going to be some more interesting short-term questions that are not Fourth Amendment related.
You mean like the whole body of discrimination law?
Right.
The other thing I would wonder is whether special needs analysis may come in the context, if we were talking Fourth Amendment, in terms of it not being for law enforcement use. I know that's a little bit of a dicey area of constitutional analysis, but using it for public health purposes might be slightly different than a traditional law enforcement search. But very interesting in the whole nature of the third party doctrine, and getting the information from these companies presents a lot of interesting issues to be resolved down the road.
I think a lot of these questions are going to be resolved by how much the public is willing to tolerate, more than they are about how much the courts are willing to tolerate. Because I think that, for example, in the context of airports, there's as David Schanzer just mentioned, there's a hefty body of law, the special needs doctrine, that allows the government to be pretty invasive, at airports and other places where there's a special need for it. And I think that long before you get to the Fourth Amendment questions, you're going to have to reach the question of whether the public's going to tolerate it. And I think one of the interesting issues is that when you look back at the 9/11 experience, the public was actually willing to tolerate quite a bit. They were willing to do national ID cards, if you look at the polls, and they were willing to have the government do all sorts of intrusive things, but they drew a line, at least a lot of people drew the line at the government listening in on your phone calls. So I think what will be interesting to see is what the public is willing to tolerate and what it won't.
Well, I'm afraid we've kind of come to the close. We haven't resolved any of the questions, but we have come to our close. I just want to thank the three panelists, Jolynn, David, and Shane. I've learned so much from all of you working on this and listening to you. So many thanks again to Beth and Susan, who've been fielding questions and helping us despite the fluky chat function. We're thrilled to be working with the Duke Alumni Association. And let me wish all of our students and faculty and alumni both a safe, but also a productive, restful, enjoyable summer. Duke will be back in one way, shape, or form in the fall. We're all here to teach our students and do research and inform the public like we did today. And we're all very confident that we'll be back not only in the fall, but in many years to come. To keep providing these services that are really vital to our society. So many thanks, and we'll hopefully see all of you at events again in late August and September, and have a great summer, everyone.
Thank you.
I think.